think we are now going to move to our next conversation with Anne Quick, who is with Garmin International, and she oversees strategic business-to-business partnerships. So I'd like to welcome Anne to the conversation.
Hey, Amy.
How are you doing?
I'm good. Let me just turn my video on. Sorry about that.
Yeah, no worries. Take your time. Before we jump into some of the questions in this session, obviously I introduced you in your role at Garmin, but can you share a little bit more about your background, or is there anything else that you'd like to highlight?
Yeah, sure. So I work within Garmin, I work for a team called Garmin Health. And as you said, we are the B2B arm of Garmin, but primarily focused on working with partners across the healthcare spectrum. We also cover areas outside of healthcare, but that's kind of the core focus for us. I've been with the team 8 years, and then in my role particularly, I focus on building our relationships with payers and with digital health platforms as well.
Awesome. And I have to just say, who would have thought all those years ago with Garmin, mapping and directions, that it would turn into what it is, broaden into what it is today. And I think it really speaks to the opportunity that we have to leverage technologies that were started somewhere else into healthcare. So congrats on really, driving that innovation. That's awesome.
Thank you so much.
Absolutely. So a couple questions for you. So as we're seeing health technology, the landscape evolve, how do you identify and forge these strategic business-to-business partnerships that are, going to align with your vision and where you want to go with your wearables and AI?
Awesome. Thank you so much for the question. In terms of kind of our focus in partnerships and how we identify and create new partnerships, I should probably step back and just the mission of our team is really to build the best hardware products that we can, to create a connected ecosystem of products that all seamlessly work together, and then really create software that's also helping to enable and detect significant medical conditions. So when we think about partnerships, we're really trying to stay true to that mission and find partnerships that really further that mission along. As I kind of briefly mentioned, my role on the team is leading our partnerships with payers and digital health platforms. So that's kind of broadly what I think about when I, try and identify and start relationships with new potential partners. And then beyond that, when we think about AI, we're really excited about the possibility of AI to help innovate through personalization. Health is so personal. You can't really have a one-size-fits-all approach to healthcare, and the ability for partnerships that deliver on personal health solutions and tailored experiences is something we're really excited about. We're doing that on our end, and we're looking for partners that can also kind of create that environment of personalization in healthcare. And so those are kind of some of the things that are in the back of my mind as I'm trying to identify and seek out new partnerships. And then when it comes to actually forging and creating those relationships, it's all about relationships and building relationships however you can, whether that's virtual or in person. Always prefer to do that in person if we can, but doing as much networking, whether again that's at an event like this and being able to showcase what Garmin brings to the table through an event like this, through in-person events, trying to stay on top of the trends as much as possible, reading as much as you possibly can, staying on top of the studies that are going on, and then being active on LinkedIn. So I invite everyone, if there's interest, to talk after this, to connect on LinkedIn, because that's been a really awesome way to create those new relationships.
Well, I'll just repeat what I shared in an earlier session. That's an open invitation. So definitely take advantage of that very generous offer. That's great. Yeah, and again, it's all about collaboration. But so with these partnerships, can you share any sort of specific factors that you're thinking about when you're evaluating those potential partners? Obviously, not everything's going to be a good fit. So are there things that you can kind of weed out early on and then kind of refine over time? Anything you can share there?
Yeah, absolutely. So, again, we're kind of broadly speaking when we think about new partnerships, it's does this partnership help improve our ecosystem of connected partners? We know what we do really well and what we bring to the table, which is we're creating the best in class hardware that we can. We're focusing on being able to detect and monitor different elements of your physiological state at any given time. And so we know what we do best, but we also don't do everything. And so we want to create partnerships with data-driven partners that are using analytics that really bring context to the physiologic data that we provide. So what you're looking at on a wearable is only, you can really only contextualize that in unless you have meaning and knowledge of what that actually can do for you. So knowing your sleep is great, but being able to get insights on how you can improve your sleep or how your sleep impacts other things that you're going through is really important. So we rely on partners to really bring context and further meaning to the data and metrics that our wearables provide. So assuming that a partner can do that, like those are some of the things we're looking for. And then furthermore, for us as an organization, data privacy and security is of the utmost importance. We're a global business. We do business in multiple different countries. And so there's a vast array of privacy laws that we want to make sure we're adhering to. And so, and also partnering with companies and organizations that value privacy and security is important to us as well.
Absolutely. And, speaking of that, how has your team, and can you share any challenges that you've had as it relates to the interoperability or the data integrations, when you're working with different partners on, these wearable tech projects?
Yeah, yeah, absolutely. So in terms of kind of interoperability, that's super important when we're thinking about our partnerships, because that is how they get access to this data and can really incorporate it into the programs with the goal of helping patients live better, healthier lives. So we have developed a full range of APIs and SDKs. These are different tools and mechanisms to get different types of data, different frequencies of data. And so it's that seamless exchange and offering kind of those simple ways to get access to that data is something that we feel is super important. And doing that a lot of which is free. And so that I think is something that's super important. And then we also kind of have developed and further invested in our team so that we can not only provide access to ways to get the data, but then also support our partners that are integrating that data and support and collaborate with them on, okay, is this working? How's this testing going? What can we do doing better? We're constantly taking the feedback of the developers that we work with from our partners, and we're kind of keeping a running list of, what is it that they're looking for? What is it that we bring to the table that's really great, but what are some of the elements that are missing? What can we do better? And so there's a constant collaborative and iterative process with our teams working together. We work really closely with our partners developer, and so the developers from our partners, and we value that feedback so much. So it's that constant collaboration is really key. And then always trying to improve on what we're doing. Our team is the team that manages our suite of APIs and SDKs. They're staying on top of the trends as well and trying to understand what are the elements that we are missing that could make our solution even better. And when we find something, we're not afraid to change our roadmap, add things, and they're dynamic in how they work so that we can bring the best solutions to the table that we possibly can.
I think that's great. I mean, we definitely had a theme of collaboration across the different speakers today. And this is another really great example, not only of partnering, but how you work together to improve the iterative process, the continuous feedback loop to optimize, which is really what this technology space requires to enable you to improve and optimize rapidly as well. So I think your your sort of formula there is great. And again, I always love the collaboration piece that, you know, you can end up with something much better than some of your parts when you work together. So that's amazing. Can you talk a little bit, like, through these partnerships, how have you ended up scaling and
Yeah.
scaling your wearable technology, and how does, you know, that partnership also benefit, you know, really the ultimate goal is to scale?
Yeah, absolutely. Partnerships have been so critical to scaling our solutions and integrating those solutions into various healthcare settings. So in terms of like, taking a step back and thinking about our team, we're a very small but mighty team. We kind of operate like a startup within a larger organization. And so we're really scrappy. We have to, find these partnerships that allow us to expand our reach. So that's for us partners. We wish we could talk to every doctor, administrator, nurse, health professional out there. But again, we're small but mighty team. So these partnerships allow us to um, inform more health professionals about our wearables, the metrics they bring to the table, and then, ultimately allow us to impact more patients. And partnerships also allow us to leverage a network of existing relationships as well, not just forming new ones, but being able to tap into the relationships that our partners have already formed, and bringing value to those partnerships for both our partner and for us can be really beneficial. And then in terms of, we talked a little bit about the integration piece, but being able to then enhance our integration because we are bringing value to our partner solution because we're adding new elements into it, and they are bringing value to us in return. So we find that really, beneficial. And then again, I kind of referenced this already. We know what we're really good at, which is building the best hardware, making services that complement that hardware. But that is, what we know we do best. And we want to partner with the best in breed solutions that really bring full scope platforms that can have a greater impact on an individual's health and ultimately help them to achieve their health goals. And so we know that partners are critical for us to have that level of impact that we want.
That's fantastic. That's really great and very impressive. So, how can you share? I mean, obviously, you've talked about the synergy and support, but can you give any specific examples of how your company has leveraged the partnerships that you've had to enhance specific capabilities and features of your wearable devices?
Absolutely. Yeah, absolutely. So I think what's really great and what I love, one of the things I love a lot about working at Garmin is that we are vertically integrated. So we can move very fast and make changes very quickly. And I think that's a competitive advantage. So when a partner does bring a great solution to us, something that we don't currently do, we can act really quickly and make changes. So we've done a lot of things. I think you talked about our developer programs. That's a constant example of how we're, a developer will say, hey, it'd be really valuable if we had this piece included, or we need it actually, at this frequency instead of this frequency, and that would really allow us to do X, Y, and Z with our solution. So that is a constant collaboration, constantly, taking that feedback and as we consider how we evolve the platform and making changes. But we've also done that with products as well. So we were working with a metabolic testing partner who had a lot of female patients that were working with them, and they really hated wearing like a regular chest strap. And based on a lot of that feedback we got from them and then other partners that we worked with as well, we decided to create a new product. It's a heart rate monitor that actually clips onto a sports bra. So it doesn't have that really uncomfortable
Yep.
effect around your whole, top. And so that was like one example. And then just improving sleep as well as another example. So a couple years ago with sleep, we did kind of, awake, light, and deep classifications of sleep, and partners were constantly telling us like we need more here. Sleep is a critical element of what we're looking for from Garmin, and using kind of that feedback, we brought changes to sleep, advanced sleep, bringing REM sleep in, doing updates to our algorithm to make it even a better quality indicator of your actual sleep, and then also bringing sleep metrics on the device directly instead of just on the companion app and the software that comes with it. So yeah, there's a lot of examples of constantly taking partner feedback into our minds and kind of making changes to improve what we offer.
Those are great. Thank you for the specific examples. It's always nice to hear that you get the specificity. And as we close out, I have to say I've been seeing a lot of little hearts go up in the chat. So that's always fun to see, and
Yeah.
obviously great conversation. And I have to say, I just go back to what I said at the beginning. It's just amazing to see, Garmin go from a navigation system from a few decades ago to,
Yeah.
major players in the healthcare space. I think it's a fabulous example of transference of the technology into healthcare. So I think it's great, and congrats on all your success. Before we sign off though, is there anything else you'd like to share before you go?
No, I would just, I guess the only comment I would have is just in your poll. I'm so glad you did that poll because it's really encouraging to see how many people responded with
Yeah,
either slightly or higher using wearables. And so I think that will only expand over time. And I look forward to connecting with a lot of you after the
absolutely.
session today.
And
Thank you.
thank you so much. I look forward to staying in touch, and be well. And again, she invited
Thank
everyone
you.
to reach out on LinkedIn. So
Thank you
take
so
care.
much. Take care.
Bye bye. Have a good one.